Greetings from Al Zahra Hospital, Dubai. I am Dr. Syed Sakib, Interventional Cardiologist and Clinical Lead. Today, I have Khaled with me. He is one of the very few survivors of prolonged cardiac arrest. He is a miracle. I will request Khaled to tell his story.
Thank you, Dr. Sakib. I'm Khaled Ismail. I'm Egyptian. I work in UAE for the past 12 years. So when you ask me to tell a story, it's become a bit emotional because it was a bit of a tough story. So what I have is, I remember quite well on the 5th of April 2018, I had, it was a normal day. It started as a very normal day in work. I went actually to the office. I had a very good day at work. And then afterwards, I went to the gym. So at the gym, towards the end of my workout session, which was a normal workout session, I felt very dizzy. I felt I couldn't walk, so I ran to the washroom. I thought that it was just a bit of a hypotension. It's just hypoglycemia or hypotension. I was not feeling well. But then at the washroom of the gym, I spent like 10 minutes. I wasn't able to breathe. I felt like stabbing sensation in my chest. Everyone panicked around me at the gym. I didn't know what's happening actually. And surprisingly, I'm a pharmacist by training, but I couldn't figure out those symptoms were a heart attack because I never suffered any cardiovascular disease. I always been a person with a good stamina. I work out almost every other day for the past like 3 or 4 years. So then I started feeling numbness in my left arm. The stabbing sensation started to be even more painful. And then I couldn't breathe well. I felt like the air coming in was like very cold. I wasn't even like, at a certain point I wanted to stop breathing because it was really painful. The good thing is that one of the people at the gym, I remember him quite well. He was like, started to tell everyone around me, this guy is having an angina, a heart attack. You have to move him fast to the hospital. 5 minutes later, the ambulance came. My wife also joined me. And the ambulance, in less than a minute, took me to the car and they moved me to the hospital. And I want to actually take this opportunity to say also some good words to the ambulance people, because the time they took me from my home, or actually from the gym to the hospital, according to my wife, was around 8 minutes, and the usual journey takes around 30 minutes. So the guys were amazing, and actually the infrastructure was amazing. Yeah. Here at the hospital, I think what happened is after a couple of minutes, and that's at least how the story was told to me, after a couple of minutes I was here, I lost conscious. I actually started to get a bit better. By the time I arrived to the hospital, I think the mix of aspirin that I took from the ambulance and the nitroglycerine that I took here in the emergency room started to kick in, so I felt a bit better. But then I was talking to my wife and my father-in-law, who was trying to comfort me, telling me that everything will be all right. At a certain point, I was just telling my wife that I missed my son, whose name is Malik, by the way. So I was just saying I missed Malik, and all of a sudden, I don't know what happened. I lost conscious. And that's the story of my wife telling me that the last words I've said is, help me. And then I lost it. I went into, that's it. I went into
So you don't
deep
remember,
sleep. I don't remember exactly what happened, yeah.
So you don't remember anything. Let me carry on the story from here. In fact, at that moment, Khaled developed cardiac arrest. Cardiac arrest means either heart getting stopped or beating very, very fast chaotically, causing disruption of blood circulation to the vital organs such as brain. Now, if circulation cannot be established quickly in this sort of situation, then death is inevitable. So how do you reestablish circulation when someone develops cardiac arrest? And the answer is by external cardiac massage. In medical terms, we call it cardiopulmonary resuscitation. We need to remember that you or anyone else walking in the street can get training in cardiopulmonary resuscitation and save lives, whether it's in a bus station, train station, restaurant, or at the gym while working out. Someone like Khaled can collapse. Now, that is the key to bringing someone from the death. Now, what happened in Khaled's case was very unusual. His heart was not beating for 50 minutes, and there was about 15 staff members of the hospital, including doctors, nurses, who were chasing death and who was trying to bring Khaled from the inevitable death. And it was so orchestrated that eventually Khaled had a heartbeat, an effective heartbeat, and that's the time I decided to take him to cath lab to a life-saving procedure called angiogram and angioplasty. It's a simple procedure where I took Khaled's heart arteries picture and realized one of the heart arteries was blocked with blood clot. It was a matter of 10 minutes to unblock that artery, and then we could all see that Khaled's blood pressure was going up, his ECG was getting better. Though he was unconscious, we had to put him on life-saving machine. He survived on ventilator and he came back. Now, from Khaled's story, I think the message is very simple. He's a young man, he's in his early 30s, and he's fit. He never felt unwell. That's how sudden death happens in apparently healthy individuals. He thought he's not having a heart attack, but he had the symptoms. So whenever someone is not feeling comfortable with the chest, whether it is front or back, must seek medical help, must call the ambulance rather than driving to the hospital. We need to remember that the paramedics may give us life-saving drugs or maneuvers, and they can bring patient very quickly, as Khaled says, a journey which would have taken 30 minutes. Ambulance brought him to hospital in 8 minutes. And when we are talking about cardiac arrest or a heart attack, time is a big, big factor. I would like to thank Khaled for joining with us, and I must say, he is a great fighter.
Thank you.
I wish him all the health for many, many years to come.
Thank you very much.
We will beat heart attack together.
Thank you, Dr.
Thank you.